And this just continues that process. It's a journey we're on, but let's just keep going. And so with that, let me start walking through the presentation with you, with your permission. What I'd like to do is first give some background information on our economy. And to start with, we're turning the corner. If you look at job growth, personal income, home sales, home prices, population, they're all positive trends. And I'm going to walk through a slide on each one of those first 3 points in particular. Michigan's employment, if you look at the situation there. Look at the positive trend. We had the lost decade. Basically, from 2001 to 2009, 2010, we had decreases. We've seen positive outcomes the last 2 years. The forecast from the University of Michigan and the consensus estimates show that we're making positive trends back over the next 3 years. Unemployment rate, if you go to the next slide. This shows where we've been, where we're currently at. And if you know, as you recall, we were 50 out of 50 for a number of years in terms of having the highest unemployment in the country. We still have a ways to go, but the improvement's been quite dramatic in terms of percentage points decrease. And if you look at the trend line, we continue to see a positive trend. Our goal is to actually beat this forecast. What I'd like to see is actually us improve better than the rest of the United States at some point. Personal income growth. This is an area where we used to be among the strongest in the United States. If you go back to the end of the last decade, if you go back to 2000 or so, we were in the top half of the 50 states. We dropped into the range of the 40s of the 50 states. Now we're starting to show positive comebacks. This last year, where we were one of the fastest growing, we were a top 10 state in terms of personal income growth. And if you look at these trend lines, it shows positive improvement for the next few years. Housing. Again, a situation where we had very high levels for a number of years. We saw a dramatic decline. Now we're seeing a positive trend line back up and forecasted improvement over the next few years, which I think is just great for our economy. The construction industry has an opportunity for a good comeback. If you just look at all these slides in total, they're all positive slides. Michigan's economy is working well. The question is how do we work better? How do we go even faster? I did mention population growth. We are growing again as a state. We were the only state that lost population over the last decade. It wasn't a big number, but we added 6,000 citizens last year. And we need to keep that up. And we need to focus on keeping our young people here in Michigan. And we're going to stay committed to that. Now, let me talk about some of the risks. And I think these are important. And we do have to recognize that the forecasts that you saw are not without risk. Our budget challenges are not without risk. There are several I would mention in particular. This list is shorter than last year in terms of the external risk. But number one, in terms of greatest risk, I put the federal government on that list. The federal government, Washington, is a mess. They haven't done a budget. They haven't reformed the tax system. And our national debt's growing way too large. All those issues need to be addressed. And they're significant threats to the comeback of Michigan. I would contend our economy would be growing much better and faster if those issues would have been resolved. And we still face major issues as they look to how to address them, and I hope they address them. This next one is actually still an issue, but probably less significant than in prior years. Global issues, particularly Europe. In the past, I also had China on the list. But we tend to see more stability in Europe. The Chinese economy seems to be more stable. So in terms of global threats, hopefully that's somewhat less than what it was before, but it's relevant to still have them on the list of concerns and issues. These next three, I'm turning inward. These are Michigan issues, these next three risks. The next one is challenged local entities, is we still have a number of significantly challenged local jurisdictions and school districts that are going to require a significant amount of time and effort that we need to deal with. You're familiar with a number of the situations where we have emergency managers. In particular, I'll mention the city of Detroit. I'm waiting for the financial review team report, and that's an issue that could consume significant time and effort from people across the state. And we do need to support Detroit. We need Detroit to be on the path to being a great city again, and I'm committed to see that happen. The next two are ones that I want to add that are cultural issues in my mind. The next one, ensuring long-term solutions. This is something that if you look at what we're doing, we're building a long-term path of financial stability and success. And too often when we tend to come out of a recession, it's easy to go back to old habits and forget about that. So you're going to hear about positive increases in rainy day fund, other efforts like this. This is not the time to say, let's go back to the bad habits that caused us financial messes over the last decade. Let's continue to be more thoughtful, put in better practice, and really stand up and represent our country in the best way. As currently, I would say we're actually a role model for what the rest of the country needs to be doing, particularly Washington. And then the old bad habits. Again, I've lived this movie too many times. I'm an old guy. I like to tell the story of coming out of school in 1982, and by 1984 or so, things were improving, and we didn't do anything that we talked about in 82 to really make sure we didn't continue our long-term decline. That still continually concerns me. It's too easy to forget about things when things start to improve and not move forward. So let's keep moving forward. Let's do it right this time. Because unfortunately, I can tell you some of the things that were talked about in 82, we talked about 2 years ago. Let's not keep that out. Let's get things solved, let's move forward, and let's reinvent Michigan. So with that, I'm going to move into a number of summary slides, and I'm going to do these fairly quickly. These are things that I think are very helpful to leave with you, to give you information, to give you an overview for either people in the press or the audience to look at an overview of the budget, because it's a very significant document. In terms of looking at the overall budget, it's going to be close to $51 billion. That includes all funds, so it includes federal resources, everything all-inclusive. The largest two items I would mention to you are two things we're proposing is transportation funding. That's an addition of $1.2 billion, and the second one would be Medicaid expansion at $1.3 billion. If you look at 75% of the spending of all funds go to education and health and human services, though. In terms of looking at the general fund and the school aid fund as a bucket, over 60% of those two funds go to public education. We're making a significant commitment again this year to that, as you'll see in the next slides. In terms of ongoing investment for this next year, we have ongoing investments, an additional $182 million. Almost half of those funds are going to education. And I'm very proud of our commitment to education. In terms of one-time funds, we have many more one-time funds available than ongoing funds. They total $413 million. Of that, though, we're actually making a significant commitment to our savings account and to education there. Continuing education, but if you look at the blue group in particular, budget stabilization in the health savings account, of that $413 million, we're suggesting $178 million is our recommendation to be saved. Then if you combine both ongoing and one-time investments, just to put that in a summary fashion, 61% of the total investments that we're recommending are either for savings or for education. This is a responsible budget. This is a budget to look to that long term and to learn from our past mistakes in terms of prior decades. We're also going to have a request for a supplemental for 2013. Three items I would highlight in particular, some you're aware of, but I think some are urgent issues that we're becoming aware of that I think are important. The first one is there's a need for emergency harbor dredging. Lake levels are record low in Lake Michigan and Lake Huron. We do have some resources in restricted funds, $10 million for waterways. We'd like to redirect that towards emergency dredging. Again, we would put off those projects for a year and then hopefully come back and do them, but delay that for a year. The other piece is we're recommending $11 million in general funds for harbor dredging. And we would request very prompt action on this because the season is coming. And there's a limited amount of resources available to do this work. The second one is a continuation of something I talked about in the State of the State, our veterans. And Brian's going to cover a slide. The Lieutenant Governor has a slide on veterans later, but we don't want to wait in fiscal year 14. We want to move ahead now, so we're going to have a request for $2.9 million to initiate a number of veterans initiatives to give them better service that they deserve. And the last one is the healthcare exchange. We've received a grant from the federal government for $31 million. We need your authorization to move forward with that, and that's critically important. Time is important on that. We have deadlines we have to meet by this fall. So I would recommend those to you in terms of supplemental. Now, in terms of the budget itself, again, I've mentioned some of these themes, but they're important. And I'm proud to say I'm a CPA, and we do need to think about as if we're doing a financial plan for a family of 10 million people. And you start by saying, let's invest and save wisely. What's involved in that? First of all, you have to live within your means. We don't print money like the federal government. We need to live within our means. We need to prioritize. There are decisions that need to be made. You can't fund all things. And those things have to have real results. There needs to be value for money. And recognize there's real value with measurements. That's our system of dashboards and scorecards. Also, on the invest and save side, there's short-term and urgent issues. I mentioned one in particular were the harbor dredging. I'd also put veterans in that list. But also long-term and important things that we need to be thoughtful of in making long-term investments. And we're doing some of those in this budget, like early childhood, about looking to kids when they're 3 and 4 years old to say the real return is hopefully going to come when they have outstanding careers and they're living in our state and having children themselves. So with that, let me walk through a number of items. First of all, on the topic of paying and lowering our bills. Just as a financial planner should do, before you go say, I'm going to go spend money, we should be looking at the bills we have to pay and making sure we're on a payment plan that's responsible. And I want to compliment this legislative group for your track record. Over the last couple of years, we've done tremendously positive work on that front. First of all, in the retirement front, we've done well, and I'm going to share a slide after that, so I'll skip on to bond obligations, is we're doing a thoughtful work there of taking care of our bonds. We're going to be asking for more bonds this year in particular. I'll mention one area in the clean water area in terms of sewer water infrastructure. But I want to thank you for your work on the capital outlay process and some good improvements to capital outlay and how we handle that process. Those were good reforms this last year, and we're making sure we've got a payment plan put in place rather than just saying there's bonds. Well, where's the payment to go with them? And then updating old, outdated, and worn assets. And these are important assets. Our armories for the National Guard, our veterans' homes, our state buildings, and also our IT infrastructure. We've made a number of investments in the past, and we need to keep that up rather than let them fall into decay and neglect. If you go to the next slide, though, on the retirement reforms, this was just outstanding work last year. This is huge for the future of Michigan in terms of retirement reforms for both MIPSers and the state retirement system. In essence, we eliminated a huge amount of our liabilities. On the MIPSer side, we had $46 billion in liabilities. We dropped that to $31 billion between reforms and putting funding paths in place. That's $15 billion. And then for the state system, we dropped $5 billion. If you take those and look at our population, that's $2,200 for every man, woman, and child in our state. If you just take the MIPSers piece, the public employee piece that covers our schools, that's $10,000 per student. That's good work. Thank you. Now, investing in our future. A number of categories here. I'm going to do several to start with, and then the Lieutenant Governor is going to take over. Infrastructure. I'll go immediately into those slides. Driving the economy forward. We need to invest $1.2 billion more in infrastructure in our state. And I don't say that lightly. Why do I say that? There are 4 key layers to the analysis that I would present to you. First, it saves us money. By investing $1.2 billion a year, we can save twice as much money. And I'll show you a slide on that, so I'm going to keep going, and I'll come back to that slide. The second one is saving on vehicle repair costs. We looked at vehicle repair costs in Michigan versus Ohio, Indiana, Illinois, and Wisconsin. And on average, we're $81 higher per vehicle. If we could drop that significantly by better quality roads, that's a benefit to all our consumers. And to put it in perspective, that $1.2 billion costs roughly $120 per vehicle. That would bring that net cost down to $40 a vehicle per year by improving that metric. In addition to that, it would create jobs. The estimate, both direct and indirect, is about 12,000 jobs. That helps everyone in Michigan in terms of all the business effects, employing more people. And then finally, there's no price you can put on this. We can save lives. Nearly 100 lives a year is what we've calculated. And people may wonder, how do you do this through simply building better roads? Think about this. When you're traveling those roads, have you ever gotten tired? And if there's a rumble strip or not, it can bring you back and keep you alert versus driving off that road, going into a ditch and dying. If you have an opportunity and you have an accident, you slide off a road, and there's those nice big orange barriers that have water or sand in them to stop your crash versus running into a bridge. that could save your life or some loved one. These are the kind of places we could use these dollars to invest and save lives. Not only would this cover roads, but it would also cover many other infrastructure projects: bridges, public transportation, rail, and again, harbors. All important needs in Michigan. Now let me talk about the $1.2 billion in terms of looking at a chart. Here's a chart that shows our state trunk line pavement conditions and what the forecast would be with and without this investment. The green line shows with the investment. It shows that we're doing reasonably well now, not as great. Nobody likes our roads today. We're at 87%, 83%. If we make that investment in 10 years, we could be at 88%. If we don't make the $1.2 billion investment, we did a calculation to show what condition would we be in. That would go down to 39%. And that when we're at that 39%, what was the bill we would get? What would be that bill that would come in the mail to say you want to bring that 39% back to the 88%? $25 billion. So this is the classic, you can change your oil or you can rebuild your engine. $1.2 billion a year, that's $12 billion over 10 years. Failure to do so just means we're going to have really crummy roads. Think about the lives that would be lost driving on roads that terrible. Think about the vehicle repair costs. Think about the foregone jobs. And think about that really big bill. Folks, this is common sense to me. This is something that the tradition is, the political process, and politics makes this hard. But if we're a family of 10 million people, this is common sense. We can, and hopefully will have a very thoughtful discussion about, is it gas tax, registration fees, a lot of things. But we need to make this investment. And I hope we can work well and work good together on making this happen for our 10 million customers. P20 education system, going to education. And I use the term P20, and I did that on purpose because my view is we need a much more seamless educational system in our state. And what does the P mean? It actually means prenatal through 20, which is lifelong learning. Because the goal here is outcomes, not what silo you're in or what silos you go through. And that gets to the first point. We need a more seamless system that works well together. And this isn't suggesting eliminating the groups we have, but making it so it's seamless handoffs where people are working much better together to deliver results. And focused on outcomes, not spending money. We spend a lot of money in Michigan on education, and we're not achieving the outcomes our students, our kids deserve. And we need to solve that. And it begins by defining why does this system exist? It's all about student growth. That's the measurement that means the most until you get to the next one, which is actually saying, what's the point of an educational system? And my book, I have 2 in that list. It's to get a career. It's to be able to make a living. And we have a disconnected system between supply or educational system and where jobs are today, and we need to solve that. And we're going to have summits later this year to address that. But the other one is you always acknowledge their self-enrichment. I'm a good nerd. I always want to make myself better. So that needs to be on the list also. But we should come back and ask this question more often. Why does the system exist, rather than just simply saying, what resources, inputs are we putting in the system? The 3 tiers, obviously, early childhood, K-12, and higher ed. I'm going to walk through each one of those. If you look at the investment from the state, it's $15 billion total, $13 from the state itself. So with that, let me talk about one of the things I'm most excited about today. We want to recommend a large investment in early childhood, our youngest. Because if we get them on a good start, a good path, it makes a tremendous difference in terms of their entire educational experience and hopefully their opportunity to have a career. We're recommending a $130 million investment over the next 2 years. This investment amount would more than double the amount that we invest in early childhood in total in 2011. In 2014, $65 million, creating 16,000 new placements. We're also recommending an increase in the per slot, the placement amount per year from $3,400 to $3,625. And then in 2015, a budget recommendation to say another $65 million with an additional 18,000 placements. This is a value add to all, but let's show a chart on what difference this would make in terms of dollars and placements. Look at the dramatic opportunity. It's been estimated we probably have 29,000 kids that would be eligible for this program. By doing this, we can make a dramatic change in their future, and it's a great investment. They win in terms of their own growth and opportunity. Society wins. It actually brings costs down. It should bring a significant cost savings to K through 12 in terms of saving them money. Let me talk about K-12 now. Again, the focus needs to be on student growth. We're recommending an increase of $227 million. That's a net 2% increase in educational funding. 2 or 3 key points of that, subpoints, an equity payment to the lowest funded foundation districts, bringing that up to $7,000 per pupil. Continuing performance and best practices, as well as technology grants. The amounts available for those have to change because of where the budget is, but we think those categories are all important. And then online courses, not just online learning, period, but blended learning. How do we do better blended learning, where we bring online with the classroom together in a thoughtful fashion? Now, this next slide I really want to share with you because this shows our commitment, that we have been investing in education and we are going to continue to invest in K-12. What this slide shows is on a per-pupil basis, the state dollars that go into education. So when you look at this, one of the first things you'll see is, well, you'll see slides in the $6,000 to $7,000 range, and you'll go, well, the foundation allowance is higher than that in some cases. Well, that's because they're local dollars of, on average, about $1,200 at the local level. So you'd really be adding that. And this doesn't include federal dollars because, again, for several years we had short-term dollars for federal education aid, but they were not sustainable dollars and they were never intended to be long-term dollars. So I thought it important to be right up front, real straight to say, let's look at the state budget, let's look at state dollars and how many state dollars are going into K-12, and we've been investors in kids. We're doing it through different ways than been done in the past. Not just through foundation allowance. I don't believe that's the best answer. We've been doing it through other things, in particular helping with retirement costs. Retirement costs have been a huge issue for school districts. And this really takes that on as part of the retirement system reform. So if you looked at it, if you go back to 2010, we were investing $6,622 per pupil in K-12. Our recommendation this year is $7,357. That's an 11% increase over the last few years. That's a good investment. Now let's make sure we're measuring growth. Again, let's come back to that point about student growth. We need to improve. Now let's look at the retirement side of things. And again, I apologize. For those of you not a CPA, you might be shaking your head, oh my God, what is this slide? This is talking about projected MIPSR's total contribution rates. Because school districts, other places that are part of the MIPSR system, basically get a bill every year as a percentage of their payroll. They have to put money in the retirement system. And that system, that number had been growing dramatically. To give you a point of reference, if you go back in the last decade, if you go back in the 2000 time frame, that percentage was in the teens. So it was climbing dramatically. And if you follow the red line, that red section, the very top of the line, that's what the line would have been with no reforms. Remember how I said we saved $15 billion? That red section is the $15 billion worth of savings by our actions. Just think of that. It would have been in excess, 35%. That's huge. That would have decimated many districts. The other part is, besides the red, you see the yellow. Those are state dollars. That yellow band are state appropriations that we worked together on making happen in the past, and we're talking about doing it in the future to help provide more dollars for public education. It's not in the foundation allowance, but not to count these dollars is an extreme disservice. This is an investment in education, and it's going to make a large difference in their success. And if you look at those two together, you can see the numbers on the side. They total $565 per student in 2014. So our recommendation has the $250. Actually, the yellow number is the middle one. If you look at that, the $250 per student. But when people talk about education funding, we should also remind them, the red section, that they never got a bill for $315. That if we hadn't acted, they would have gotten a bill for $315 more. Huge investment and huge reforms. We should be proud. Higher education. Again, we need to make a commitment there, and we are. We're making an increase in university funding. Again, we did a lot of good work together on funding formulas. We're not suggesting changes in funding formulas there, but we're looking at a 2% increase. Community colleges. We do make some minor modifications there, again, to focus on performance, but we're talking about a 2% increase through the performance funding model. But I would also mention when you include the retirement cost piece, again, they're part of the MIPSR system, that brings the total investment in this next year in community colleges to a 14% increase. Very dramatic. The last one I want to spend a moment on, the capital investment challenges for 2015. This is something I wanted to send the signal to say we had limited resources because we made a huge investment in early childhood, but we do care about higher ed and community colleges. So in the 2015 budget recommendation, I asked something to be added. I actually asked for 2 capital challenges to be added. That for 2015, we're recommending a $100 million bond issue to universities that come forward with the most competitive proposals on how to increase engineering students and engineering graduates in the state of Michigan. For community colleges and ISDs, I asked that we put in the debt service to do a $50 million bond issue for skilled trade training for those organizations. So I hope you follow through with this recommendation, because I would like to make this a competitive, open process. $100 million of capital for engineering, $50 million of capital for skilled trade investment. And let's have some good competition. Let's have innovation. Let's have collaboration and have groups come together and work together. Well, let's have people earn those dollars where we can see a great return on investment for more engineers and more skilled tradespeople in our state. Next big topic is expanding Medicaid. I did a press conference on this yesterday. This is the right action for the state of Michigan, in my view. The bottom line is better care at a lower cost. This is not about just taking money from Washington and spending money from Washington. I don't believe in that. This is about simply saying we have people today that are treated through emergency rooms. They're classified as uncompensated care. They're still real people. They're going to the ER. It's costing society that money. And we're not doing anything to get them in a managed care model where they have primary care, they have wellness, they have preventative care, many other things they could use and need to avoid those ER visits. As part of Medicaid expansion, let's put in 300 and some thousand people to start with, over 400 and some thousand in the longer term, to say let's put them in a system where we can get them in managed care, in a primary home, medical home model, and take better care and bring down cost and give them better quality of life. It will also help with families in general, with providers, with businesses, small business in particular. One of the things we're doing is actually reserving part of the savings. If you look at it in the short term, we'll actually save money because the federal government will be taking over obligations we currently have. That accounts for about $206 million of savings. And what we're proposing is putting 103 of that, half of that, in a health savings account. I'll talk about that a little bit more in a moment. As I mentioned, the big issue on this is how do you get people to go from the ER to primary care? And one of my concerns were part of our analysis is to make sure we had capacity for primary care. So the next slide really shows there was good survey work done by people at the University of Michigan and the State Medical Society working together to show that we do have capacity. 76% on the family medicine side, internal medicine, 78% are essentially taking patients. And if you looked at those, most of those said they would take Medicaid patients. So we have the capacity to take these large numbers into our system. Now, the next one actually shows how we fill the gaps, because one of the questions is are we covering people? What this would do is cover about 46% of the uninsured, but then you add in healthcare exchanges and other mechanisms, it really does provide a more comprehensive pattern of care. The part to highlight is really the green sections. The green is what would fill in the gaps between what is currently covered by Medicaid And that lovely color, I don't know what I'd quite call it, the brownish kind of color, that is the other one, salmon. Thank you, Tanya. I'm glad someone has better taste in colors than I do. That's where the healthcare exchanges kick in. So it's really the section in green that would be covered. And that would make a huge difference in terms of care. If we don't do this, I would also mention to you that we would be leaving people uninsured. The healthcare exchanges go down to 100%. So if you look at the section, anything between 50 and 100% would be left uninsured if we don't move forward with this. Now, the last chart I want to share with you is about this health savings account idea I mentioned. At home, again, think of us as a big family. At home, quite often we have a health savings account, and we put dollars aside, just like in our IRA. And what do we use that health savings account for? We use it for co-pays, we use it for deductibles, we use it for unexpected medical expenses that may not be covered. That's the same point here. By reserving half those savings, you can see it starts at about $100 million, but it grows to over $500 million. It really provides a health savings account because as the system works with Medicaid expansion, we will be required to start contributing in several years. And that contribution grows to a 10% copay. So why not follow the same concept of saying, well, we've got a copay, we've got a health savings account, let's pay dollars out of that account for our copay. If we do that in a thoughtful fashion, if the federal government doesn't change the program, we would have funding in that health savings account to cover our copays and costs through the year 2034. That's being financially prudent. The other thing I would say is I do have some concern, as I mentioned, federal fiscal risk. If they dramatically change the program because of huge budget issues or something else, we would have accumulated a fund to deal with any shock or major traumatic events that they may bring down in the health area, so we'd have resources available to help cover those costs, to manage them in some much more effective and thoughtful fashion. This is a win for all. So this is one of the other major initiatives. And with that, I'm going to turn it over to my partner, Lieutenant Governor Brian Calley.
Well, to the chairs and committee members, thank you. It's a great privilege to be before you again. You see the savings that are accumulated, half of which going into the health savings account, the other half strategically invested, allows us to make great progress in some other areas as well. The Healthy Kids Dental being a program that has been a priority across administrations. Really, this is the third administration that has worked in this area. But with the view toward the long term, and I hope that's a theme that you pick up on, or looking toward the long term, I think this is a great example of how you can take on big issues that in 2000, when this was first taken on, the public-private partnership between the Department of Community Health and Delta Dental, it was difficult to imagine how on earth are we going to cover the entire state of Michigan with this. And so we're showing the way that pathway can exceed the time frame of a single term or a single group of people in office. And so in this area in particular, we know that the most common childhood chronic disease is tooth decay among kids, and this goes a long way toward meeting that 70,000 more kids covered in this area. Also, I'll just mention that the American Dental Association has recognized this particular partnership as one of 5 national models for improving access, and so it's a success that we want to continue to build on. In terms of making Michigan healthier, we're looking toward innovation to change the way that we do things. We don't have all the ideas here within the confines of state government, and so we're looking to really capitalize on risk takers and innovators all throughout the system and through our communities around the state. And so we're asking for a Health Innovations Grant Fund that will essentially be a DCH grant process to community organizations and coalitions that devise innovative approaches to improving our healthcare system. A few of the categories to consider would be high-risk targets, more efficient delivery, better preventative care, and improved medication compliance. Those chronic problems that we've faced for so long, and what innovative solutions are out there that we can really apply or we can try out and help aid the development of through this fund. $5 million for mental health innovations as well. This is a cross-departmental effort that will touch Community Health, Human Services, Department of Education, State Court Administrator's Office, and our law enforcement communities. But the idea is that we need better home-based mental health services, particularly for kids, better care management, treatment for at-risk youth, and then the mental health training and awareness for our law enforcement and our court systems. One area that we've got a lot of progress we need to make in is infant mortality. It's one of the benchmarks that we measure that we haven't made enough progress on. And we haven't, and so this is our real effort to both invest in this area and to move the needle to a point where Michigan can be proud of the type of results or success that we see. Of 114,000 kids born each year, there's about 825 infant deaths. The rate among African American babies and American Indian babies, the infant mortality rate is 3 times higher than the general population, or at least 3 times higher than the white population. And so we've got a lot of progress that we need to make in this area. Some of the ideas that will be aided and funded through this line item will include regional perinatal systems, the preterm birth prevention, along with promotion of safer sleeping practices. These are all things that we know we can make progress in when we make these types of investments, and we're better to do it. And then $8.7 million for health and wellness. A few of the areas that this investment will support: obesity reduction, cancer screening, and improved diabetes care, to name a few. Until we get the chronic management of health under control, we're not going to see any improvement in the type of inflationary aspect to the cost of health care. And so we're excited about the improvements that can be made there as well. Within economic development now, we've got a few things to highlight. Building on the success that we've seen in this transformation in this area over the course of the last few years, we want to do more to connect people with the skills that are demanded in the economy today. I know that a lot of you are hearing the same things that the governor and I are hearing across the whole state. It's a good problem to have. People are hiring, but the feedback we're getting is that it's difficult to find citizens here that have the right skills to fill what's demanded today. And so this will be an effort to work with community colleges and other organizations to help develop the workforce that we need to fill the jobs that are demanded today. We also have several areas of underserved capital that can really aid our economic development efforts as well, and so we are recommending $20 million for that purpose. In the area of food processing, we produce a tremendous amount of food in Michigan, but most of that food, the value-added process, happens someplace else. And why is that? We have manufacturing expertise and capacity here, and we have storied marquee names in food processing right here in Michigan, yet the opportunity is very untapped. And so we're looking to set aside resources in order to remove barriers, to first of all find out what are the barriers, but then to really aid the development of an environment for success in the value-added process for food. $3 million for that, and then to add to the $25 million investment. By the way, thank you and congratulations on your support of the most successful tourism and advertising campaign, state-based campaign in the world, really. I mean, but especially in the 50 United States. And we're looking to invest additional dollars, $4 million more, bringing it to $29 million. Now, in the good government area and improvement of the services and trying to move the state toward being a customer service organization, a world-class customer service organization, to me, the poster child for that is the exciting work that's happening within our Department of Human Services. It's a completely different delivery model than what we've seen in the past, where we have social workers that are located in government buildings that are not necessarily accessible, and we haven't done enough to really understand what the need is and to connect the services that are already available to those that need it the most. And what we started with as a pilot project in some targeted communities is to move those social workers right into school so we can determine what are the roadblocks to their success, what are the needs and deficiencies in those families, and what resources can we bring to bear to solve those problems. And so we're making a significant improvement and a significant investment in this area, bringing up the number of schools that will be participating in it all the way up to 135. But make no mistake, we're thinking of this as a new service delivery model, that this is just a start to where we can end up. And the results, I think, as they continue to roll in, this is fairly new, but as these results continue to roll in, this is a very exciting development, and I think the results are something that we're all going to be very proud of. The governor had mentioned a supplemental for veterans to make the type of transition that we're looking for with the service that is provided to veterans today. We know that we have to do better in this area. The need has never been greater in recent history for the requirement, the responsibility that we all have to connect our returning veterans, our war veterans, to the services that they need, and all the rest that have served us in the past as well. There was a recent executive order that elevated this area to agency status. We are now accredited as well. In this area, the state itself is accredited, which will allow us to make a lot of advancement and improvement in the service and the access that our veterans need and deserve. And this continued focus in the area is going to bring us from, right now, by the way, we're last among 50 states and 2 territories in utilization of veteran services. We're dead last. And we must improve in that area. That's what this is all about, and we certainly appreciate and look forward to working with you on achieving that goal. The category of making our state safer, we have started the process, and we're starting to see the fruits of the work that we've done together in the past, and in making investments in our state police force, so we can have a mobile force to deal with problems and crime where they exist. And now that we're having troopers graduate from schools, we're getting ahead of that retirement process so that we can add to the capacity of law enforcement in this area. Mental health courts, we have 9 of them around the state today. We're looking to expand the capacity and the services available in those areas. When somebody with a mental health issue comes in contact with law enforcement, the needs and what is appropriate for that population is different than those who touch the legal system in more traditional ways. And so this is a recognition of that, and we know that we can do better. And this increased investment will create an environment where people at the local level running these courts will have the resources that they need to provide more appropriate intervention services for people with mental health issues that touch the criminal justice system. Treatment courts, we all know across the state that there has been great success in drug courts and sobriety courts, and it's starting to become more of a norm, and that's a very exciting development, a positive development for all of us. I'm reminded just a few years ago I had the privilege of attending a drug court graduation in my own home county. And I met with one of the folks that was graduating, a young man that had been in and out of jail several times on drunk driving convictions. And he had been sober now for a year, and he had graduated from the drug court. And I met with him afterwards. I asked him, what is the difference? So you failed before, but you succeeded this time. He said, well, I had to meet with the judge every single week. I said, so Judge Vogt, he's that scary? You had to meet with him every week, and that was a certain amount of just accountability that resulted in a change? I said, no, he wasn't scary at all. It's the first time in my life I had somebody that cared about whether I succeeded or failed. It occurs to me, it's so sad, but it's so simple that this model is working. These aren't hardened criminals. These are folks that can be productive members of our society if we provide the right type of structure or support around them to get them back on the right path. In the last category in this area I'll mention, by the way, the recidivism rate for those who graduate from drug court is half of those who don't, or those who go through the traditional system. And so these are results that we can be proud of and we want to build on. In blight elimination and the good neighbor property maintenance investments that we're looking for, we need to take the tax reverted properties and assemble them and prepare them in a way that makes them feasible for economic development. So we're looking for resources in order to do that. But then also, when the state owns property, we need to be good neighbors. We need to take care of the properties that we own. And so we're looking for resources in order to do that as well. In our natural resources, this is an area it's very easy to put off for one more year because some of these problems have been around for so long. But we can't afford to mess up with water quality, particularly here in Michigan. The first item on the list here being the storage tank cleanup. There's a huge need in this area. I would compare this to the Healthy Kids Dental area. It's so big, sometimes it's easy just to set it aside and say, we don't have enough to cover the whole state, and so what can we really do? But the standards for when tanks go in the ground today are much better than they used to be. The old problem is a finite problem. It's big, but it's finite, and we can incrementally deal with it. We're looking for investment dollars in order to handle that. I'll mention the $97 million bond for the loans for local communities to improve their water and sewer systems as well. This is another huge problem. We have very old systems that don't have very good access to capital that are located, in many cases, right on waterways. And this is an area we cannot afford to delay anymore. The last item I'll highlight on this slide in the interest of time is to say that we need to make an investment in conservation officers. We're sixth in the nation in what hunters and anglers bring to our economy here, but we're 19th on conservation officers. This is an area that we need to make. It's been sacrificed in the past, and we need to continue to make an investment in. Saving for the future, this is something that hopefully everybody's become very accustomed to. This is one of the benefits of being in a growth mode, is that we can take resources and set them aside for the future. A few that I'll highlight: $75 million for the rainy day fund, the health savings fund that the governor highlighted as well, to make sure that we are prepared long into the future to cover the cost of the Medicaid expansion. But then also a new one on the list, disaster and emergency contingency fund. Every year we have disasters and emergencies that we'll be able to respond to more quickly if we plan ahead for them. And so we're looking, whether it be something like the fires up in the Upper Peninsula or other natural disasters such as tornadoes and floods and the like, that we'll be better prepared to deal with it. Because of that, we're looking for $4 million this year and $4 million next year to deal with such things. Now, for those of my colleagues that were here with me in 2007, this is not Leon Dorlet's pig. This is a different type. This is a piggy bank, and in the size corresponds to the size of the resources that have been put into that saving. This is one of my favorite charts, and you'll notice that in the beginning, when we first started, there was $2 million there that would have run state government for about a half hour. And now we've really grown it to a point where it is a real rainy day fund. And at times when we're in growth modes and when we need to take a portion of that and put it away for the future. And you've done great work in this area to encourage you to continue. So that's the end of the prepared presentation. We'd be happy to take some questions.
I thank you. We have some housekeeping things that we have to do for a moment, i.e. taking roll. And members, could you send questions with your name on them on down here? Madam Clerk, will you call the roll for the Senate?
You turn this thing on. Is it on? It's on? Okay. Chairman Kahn.
Here.
Senator Molinar. Senator Jansen. Here. Senator Papa George. Here. Senator Boer. Here. Senator Caswell. Here. Senator Kolbeck. Here. Senator Green. Senator Prose, Senator Shoemaker, Senator Walker, Senator Anderson, Senator Gregory, Senator Hood, Senator Hopgood, Senator Johnson. Chairman, you have 15.
I thank you. We have a quorum. Representative Hoffman?
Thank you, Mr. Chairman. Would the House Clerk please call the roll?
Mr. Chair.
Here.
Representatives Pacholka, Kowal, Laurie, Rogers, Walsh, Bumstead, Forlini, McGregor, McMaster, Jenkins, Muxlow, Pileski, Potvin, McCready, Howrylak, Verheulen, Talib, Brown, Durhall, McCann, Dillon, Roberts, Condrevis, Ferris, Zemke, Singh. Mr. Chair, we have 24 members present. We do have a quorum.
Now, let's get to some questions. I have a question for you, gentlemen. I'd like to know on the question of roads, since we're in both chambers working on that issue and as part of your presentation of expected budgets. How do you expect the proposed road funding changes to position our state for continued economic recovery, and how do you expect it to create more jobs?
Well, I appreciate that, Mr. Chairman. If you look at roads are a critical part of infrastructure for an economy. The easy illustration, if you go back in time, I'll actually go back to the famous funding formula question that we actually talk about in the budget. Act 51 of 1951. We actually designed a road funding formula before the interstate highway system was authorized.
Yeah.
And I think if you look at the interstate highway system, I don't think anyone can argue that it's been critically important to the infrastructure and the economic health of our state and our nation. The same thing's true within our state when you start looking at trunk lines and other key commercial corridors. So that's one of the things we'd like to have a discussion, and we do recommend that we continue to similar funding for the existing road funding formulas, but with respect to the new dollars, we actually make a focus on commercial corridors and say, how do we focus in on economic growth, jobs, and job creation? Because that's the long-term goal here, is not just the construction jobs, which are the 12,000 jobs I was speaking of earlier, but how do you create an environment for success? And that ties into a very similar case would be that outstanding idea of building a new trade crossing to Canada. I couldn't resist that one.
Yeah. Sorry. Well, I appreciate that. Senator Walker, do you have a question? Or maybe you do?
Yes, I do.
Okay.
Thank you, Mr. Chairman. And Governor, thank you for being here personally along with your team of experts. I appreciate that. I have a question with regards to the school aid. And one, I guess before that, I want to thank you for recognizing the importance of the closing the equity gap. I think that's following through in our proposal, our promise of Proposal A. But the question is in regards to the Great. I want to deviate and give you a compliment and lost my train of thought. Yeah, go ahead with.
I'll take the concept, though. Thank you.
Yes, yes. Is that a choo-choo train, is it? Representative Hoffman.
Governor, I appreciate your effort to increasing the budget stabilization fund. I agree with that. It seems, though, that the more we increase it, the more we open ourselves up for criticism as to why we're not spending it and using that resource. Can you talk a little bit about the benefit of continuing to increase that fund versus spending it?
Sure. I appreciate that, Mr. Chair, your question, and it's critically important. Again, let's go back to the family analogy. What family here doesn't try to set aside a savings account? And if you think about the amount of money you try to put aside in a savings account, quite often you want to say, I want 6 months of savings or longer. Well, the same concept's true with state government. The target range we're aiming for is somewhere between 6 and 8% of the combined school aid general fund, which would make it somewhere between $1.2 billion and somewhat in excess of that. And so I believe we have a ways to go. And what is that? What is the benefit? Twofold. First of all, it really sends a signal of financial stability, which gets critically important to investments in our state, our bond rating, for example. That's something that they look at quite often. And I'm proud to say that I'll mention a bond issue we did at the later part of the year, that we went out and did a bond issue, and I believe it was the lowest interest rate ever achieved by the state of Michigan. It was a little bit over 1%. Because we were showing how we were being fiscally responsible by the steps we've already taken. So it's critically important in terms of the borrowing, also the perception of people investing in our state. So that's very important. The other piece, as I would say, is if you look back in history, is when you have unforeseen circumstances. It's the old large emergency. Think about the federal government situation. We had a case where if you looked at the fiscal cliff, the charge coming down to the state of Michigan could have been in the range of $260 million or so. That's a huge amount of money. That $2.2 million, that little pig, wasn't going to last real long, versus saying we had significant resources to cushion that to allow us to continue to be successful because it's about taking care of our customer. So I really appreciate that question because I think it is critically important. And to be blunt, I saw some of the criticisms too, and if someone's going to criticize me for adding to the rainy day fund, I think that's a great thing. Have them keep on criticizing me because it's prudent that we keep on adding dollars.
Representative Pasholka.
Thank you, Mr. Chairman. Governor, I want to first thank you for bringing back the term crummy. I hadn't heard that one in a while. Maybe it's a word we need to use a little bit more. I want to take you back to the supplemental. And the beginning of your presentation, you mentioned that you'll be asking us for $31 million to accept $31 million in federal funds. If we do not accept that money, what are the consequences for the general fund or state dollars?
It's very straightforward. We need to spend that amount of money in either case. And most likely it would end up being a larger number because there'll be additional requirements after that. We're required by law to comply with the requirements to do a health care exchange. So if we don't have that $31 million, that grant from the federal government, it would be GF, general fund dollars. And that would not be the end of that process. Actually, I would just ask one moment of indulgence, if it was okay, Mr. Chair, is just to say I didn't get an opportunity to also say thank you to all our team for all the hard work putting this budget together, and Budget Director Nixon and his team and all the cabinet members and departments for all this, because it is a significant enterprise. And we've got a nice document here to share with you that you've always been so diligent about getting through. So I just want to say thank you to my team and thank you for your time.
I need to apologize to Senator Walker because I have your question here. No wonder you couldn't find it. My staff collected it. Duh. And the second thing is, can we get a copy of the presentation that you had in your slides to send to all members? Or
Absolutely. We'll provide it to all of you. And for the public, we'll actually have it on our website, the Michigan.gov website, but we'll provide it to each senator and representative's office, too.
Senator Walker.
Yeah, thank you, Mr. Chairman. I'll be brief. Governor, or maybe Budget Director Nixon, you may be able to help with this. You're proposing a 2% increase in the school aid spending, but it appears from the graphs that you had and some of the numbers I saw that the schools may not see much of an increase in their foundation allowance, and the press and the stakeholders usually are looking at that foundation allowance, which they can use for general operations. So I guess, can you explain a little bit how we're increasing school aid funding by 2%, but the foundation allowance is staying relatively flat?
Yeah, Senator Walker, I very much appreciate that question because, again, I think that's been a point of misunderstanding for a long time when people simply look at the foundation allowance. The real key is what are the state dollars going to the educational institution and what's arriving essentially to help support the kids. And this is where this huge question of retirement costs has not been properly reflected. So in terms of prioritizing, we thought it better and more important to address that huge growing chart that was going to 35% through retirement system reform and having the state make contributions towards retirement costs, that are dollars going to those schools that in effect help those kids. Because essentially what happens is those school systems get a bill for that yellow and green part of that chart. And what we're doing is we're sending them a check for the yellow piece that they just send back that goes into the retirement system. So in net effect, again, there are hundreds of dollars per pupil going in, but it's going into more than just the traditional foundation allowance. We are really investing more dollars, and that's why I tried to highlight that number in particular. If you go back to 2011, it's 11% higher if you look at state funds going to K-12. So thank you.
Governor, I thank you for your time and your willingness to do the presentation, Lieutenant Governor, and to answering questions. Can we have one of the CPAs remain behind to endure some more questions? Thank you, Governor.
Thank you.
Mr. Nixon, thank you for sticking around and taking additional questions.
My
Appreciate
pleasure,
that.
Mr. Chairman.
We're going to start on my side with Representative Dillon.
This is a little short. Sorry, a little taller than the stand is here. Thank you, Budget Director, for staying around, and thank you, Mr. Chair, for allowing me to ask a question. I think it's probably appropriate to kind of follow up on the question that Senator Walker just asked, because I'm a little confused, and I'm not a CPA, and I'm not familiar with all the slides that the governor put up, and it's a lot of information to digest here in a short period of time. But I think the governor just mentioned that we're spending 11% more in K-12 than we were in 2011. And I guess I'm just trying to figure out how you're actually quantifying that, because I understand the MIPSER's payment is not going to the district and included in the foundation allowance, and the state is just cutting a check to cover that, which I think is fine. But I don't know in my district in Grand Rapids or any other district across the state if they would be willing to testify to the fact that they are getting 11% more in dollars going to K-12 than they were in 2011. So can you explain that, one? And then two would be, are we still going to be transferring up to $400 million out of the school aid fund, which represents about $250 per pupil, into the general fund or for community colleges and higher ed?
Yes, Representative, thank you. I'd be happy to respond to that. As far as the investment, the dollars, we can go back to that chart, but it shows the actual total state contribution to the school system on a per pupil basis. So the dollars are there. Now, what we have and what we've had created in this state is really a house of cards within the retirement system. And that retirement system was beginning to strangle our districts. And when we came in, we realized that we had to do something about it because it was just growing at an unsustainable rate. And so what happened was the legislature and we all worked together to reform those liabilities. And in the process of reforming those liabilities, we were able to lock in the rate. In working with the districts, we worked with the superintendents, and they wanted stability in their funding. As you can see with the red chart, or if you go to the other MIPSER slide, their payment was scheduled to go up to 35% of payroll, which is a very, very significant increase in their liability for retirement. Now, irregardless of how we fund it, whether it's foundation allowance, whether it's MIPSER's payment, whatever it is, they were going to have to pay that bill. And those were funds that were directly competing with the classroom. And so as part of the retirement reform, we cut the red part out. We brought that liability down through the reforms, the innovative reforms that we made. But more than that, we wanted to start to secure the retirement for the current school employees who have been promised a benefit. Up to this point, we'd build a house of cards. We'd build a $50 billion house of cards. And so this legislature began to fund that payment. Now, the agreement with the districts and the way the legislation was passed was to cap in their long-term unfunded liability rate, which would give them stability in funding. So they're not going to keep having the increases being raised on them every year. And the state would fund the difference off of the top. And so it is money that is going into the system, and this money will go to the districts. they will have to bring it back to the state to fund that retirement liability. But keep in mind, if we weren't doing that, it would equate to a $250 per pupil cut. Okay, so whether we put $250 into the foundation allowance or into MIPSers, it's the same $250. The unfortunate thing, we didn't create the problem. The problem's been created over the last 50 years. What we're trying to do is be responsible, come in, address the problem, and start to fund it so we have stability of the classroom and so our school employees have something that they can look forward to rather than just a house of cards when they retire. Now, you had one other question, and I forgot. Oh, the transfer. The transfer. Perfect. Thank you. That's a great question, Representative, and you're talking about the transfer between the school aid fund and the general fund. And we actually go both ways. We currently have about $400 million that goes into higher education and community colleges from the school aid fund. In the 14 budget, we have about $230 million from the general fund going back to the school aid fund. It's basically how we budget. We do move those two funding sources back and forth. As the governor and I and many in the legislature like to present the budget and work through the budget, we don't based upon just available. We don't budget just based on available funding. We based upon the priority of needs and where we get the best value for money. It's a very complex, very large budget, and that's how we budget. And so to actually look at that general fund, school aid fund transfer, I know people want to focus on that. We look at it as just really trying to meet the needs in the best way that we can. And if you look at the increase in school aid fund with where we were and how we're climbing out of this recession we've been in, we feel that we've got a very good recommendation for the school system this year.
I guess the Senate's up. Senator Anderson.
Thank you, Mr. Chair. John, I appreciate the presentation. One of the things I know that was touched on very briefly was the Healthy Michigan or the Healthy Kids Dental Plan, and I know in discussion this morning we talked about it briefly. I guess what a lot of people are probably not aware of is that Wayne County is excluded entirely from this program. Never been part of the program since its existence, and I know that goes back to previous administrations too. What is the plan to bring those children into the program? Because certainly the value of their health is no different than the rest of the children across the state. We all value our children's health, and I'd like to see what the plan is when they're going to be brought online.
Thank you, Senator Anderson. That's a great question. Part of the issue with Healthy Kids Dental is that we're down to a very few remaining counties that are not covered. And those, unfortunately, are some of the biggest counties, including Wayne County. So when we look at the available funding and where we can expand, we know that we've got so many slots that we can afford. And this is done on a county-by-county basis, is the way that Healthy Kids Dental is rolled out. And so when we found the 70,000 slots that we could afford to fund in this year's budget, we identified the 3 counties that we're recommending expansion in. But again, we're always open to creative ideas on how to get more people covered. But this is a program that's been expanded and operated on a per-county basis. And so certainly when we get into Wayne County, it's going to be a much bigger county. It's going to require a certain amount of funding. But I think you can see, Senator, our commitment. We've got 70,000 70,000 kids in the 14 budget, and the 15 budget, the governor's recommending another 100,000 person expansion, and we haven't identified those counties in 15.
Representative McGregor.
Thank you, Mr. Chair. Director, I'm wondering, listening to the governor, he explained that the expansion, the Medicaid expansion, was not going to cost the state any money or until 2034. I wonder if you can help us understand how that's not going to cost the state.
I'd be happy to, and let me talk a little bit about Medicaid expansion. As the governor mentioned, we've got great staff in the budget office. I think I've got some of the foremost Medicaid experts in the country in my budget office, and I'm fortunate to have that. I think the governor and I, being 2 CPAs, have driven him nuts over the last couple of months looking at the numbers involved with Medicaid expansion. And I'm glad you asked that question because it really doesn't make a lot of sense. Somebody says, well, how can expanding Medicaid actually save the state money? Well, in the state of Michigan, we've actually gone above and beyond federal minimums for certain programs like mental health services. And those programs are totally 100% general fund programs. So the biggest savings comes through the mental health, non-Medicaid eligible mental health recipients. There's about 50,000 people that are severely mentally ill that we serve, and we pay 100% general fund for this population. It's about $280 million a year. Now, the good news is that with Medicaid expansion, not only will we pick up and be able to serve those, not just their mental health needs, but also their physical health needs, which we actually think will help wrap around to address their mental health issues. But as a result of the Medicaid expansion up to 133%, they will have their mental health care needs taken care of. Above the 133% Medicaid expansion, it will be part of the essential benefits package for those on the exchange. So as we talk about mental health services, there's going to be a lot of coverage as far as mental health goes to the population here in Michigan. But what that does is it allows us to take out a certain amount of money of the budget that we're currently spending on mental health that are 100% state dollars. There's also some savings in the correction system because inmates that are in the system, when they're hospitalized, they're actually eligible for Medicaid. And then our parolees, when they come out, when they're released from prison, many of them have health barriers, but they don't qualify for Medicaid because they're childless adults. And this expansion will pick them up as well, which will help reduce the recidivism that we think will also help save some money in corrections. So basically what we're doing is, I mentioned it's about $280 million that we're paying for mental health. Of the 50,000 individuals that we're serving, there's about 43,000 that are below the 133% threshold. And so we're pulling that money out of the budget, and then we have the remaining 7,000. We've left that money in the budget to transition those because as we start with the exchange, people will start transitioning into mental health services. So we're going above and beyond to make sure that we don't lose anybody in transition. But that does generate a savings. The governor has recommended that we take half of that savings and put it in the savings account. And as the lieutenant governor mentioned, the other half we're able to invest in Healthy Kids Dental and these other key programs. That's probably a long explanation, but I hope it made sense.
Senator Jansen.
Thank you, Mr. Chair. Two things. One is on the previous discussion with Senator Anderson. For the good senator, just know that I worked with the former director Haveman back in 2000 to work on the Healthy Dental Kids, and Kent County never has seen any of that either. So we're in good company here. So, but really, what I want to talk about was first. I'm going to act like you're the governor, so it make you feel good or bad.
Certainly not the governor.
I know. First, thanks for his common sense approach to getting Michigan back on the road to recovery. And thanks for no negative supplementals for my last 2 years here. I appreciate that a lot. Washington could use this approach, so maybe that's a future for both of you. My question, though, is as you talk about expanding Medicaid, did you look at, we just passed the Blue Cross legislation, $100 million or so is going to go into a fund and so on and so on. Did you look at possibly using that money as also part of the payment towards trying to help Michigan pay for the Medicaid expansion, even though there's savings? If you're going to set up an HSA or whatever it is, possibly the dollars could go into there because it really is intended to be taking care of those folks who need health care. So just wondering if you did look at that.
That's a good question, Senator. We did not. We built part of the increases in revenues the state will receive through the legislation, but as far as the fund, those are built in the budget, but as far as the fund, we have not spent that. That has not been taken into account in this budget, but certainly as an option that we can look at going forward.
Representative Candravis.
Thank you, Mr. Nixon. This feels like a town hall meeting here. Thank you for being here. I had a question generally, and the governor spent some time, and I know we will be spending much, much more time on road funding and some of the transportation revenue increases. And having not yet read the budget, but would like some input on it before we really start getting into that and transportation funding. If the legislature does fail to enact the legislation which would increase that transportation revenue, is there going to be a projected shortfall for our matching funds as a state to the for the federal funds? And if that shortfall will be there, how much will it be if we do not enact new legislation?
That's a good question. The shortfall is not covered in this year's budget. We have recommended the transportation package to address that shortfall. The exact amount of that's $130 million. I can get you the exact number, but we did recommend that be covered as part of the transportation package. I will assure you that we'll make the match. We'll work with the legislature to make that, but that is part of the transportation package.
Senator Shoemaker, you have a salmon question?
Thank you. Senator Pasholka and I have, as chairs of higher ed, have been talking about college affordability. Is there tuition restraint in the budget? I believe there is, but how is it different from last year's?
We used the same formula that you passed last year for the higher education, the 2% going to higher education. Basically, the way the tuition restraint works is there's a 4% cap, but once everybody submits their tuition, we'll divvy it up based upon how far below that the 4% they were. Yep. Yeah, we didn't make any adjustments. There was enough agony in coming up with that formula. We decided to not adjust it this year. You know, that will also provide stability. I mean, if you have a consistent formula, the universities can know what to expect and know where we're going to be. So,
Representative McCready.
Hi, John. Over here.
Yeah.
I want to congratulate you on the initiation of this budget. It shows, I think, great planning to pay down our debt, which is extremely important, as well as put money aside. It also shows compassion for our residents that need help. And I think those are really, I just want to give you acknowledgement of that. Also, transportation and infrastructure improvements. I know we're going to look outside of our budget for money to make up that $1.3 billion. I have to think, though, that there's some money in the general fund somewhere that we can apply towards that $1.3 million. And then just the last comment is I'm in favor of, and I'm glad to see that you want to put more Michigan State Patrol troopers on the street. But there's also a trickle-down effect to the county and local patrols. And I hope and ask you, do you have money that you'll plan on helping to build back some of those budgets that have been reduced over the past few years?
Yes, first and foremost for the general fund. I will have you know that we are always looking for operating state government services in a more economical way. The governor has a whole initiative called the Good Government Initiative that he has the lieutenant governor chairing, and he's doing a great job doing that. And basically, we're systematically looking through all the agencies to make sure that we are operating at the optimum level. When you have an organization as large as the state is, there are always efficiencies that you can find, and rest assured that we are looking for those efficiencies. When you look at the budget request, the budget that we put forth, and look at all the requests for funding, we didn't fund nearly, even close to funding all the requests that were there, pushing those into the departments for, through efficiencies, making them absorb those funding requests. So, we're with you on the issue of making sure that our general fund and our state expenditures are in check. Now, we do that on a regular basis. That's just part of our DNA that we do every year. But we'd be happy to further the dialogue with you on that issue. As far as the road patrol, there are some grants in our revenue sharing that are tied specifically to public safety. I can get you the exact information on that, but we also, as we're adding to Michigan State Police, we're encouraging the colonel and her force to really work cooperatively with our local jurisdictions. A lot of these troopers will be placed in the most critical areas that we have in the state to augment the local law enforcement. But in addition to that, part of our revenue sharing is directed towards public safety.
Thank you, Mr. Chair. I was kind of hoping to ask this to the governor, but you can probably do it. It's more of a...
If not, I'll have him call you.
That'd be different. In light of the last bill he vetoed. But what makes you so eager to partner with the federal government on the Medicaid expansion in light of the Fed's poor financial condition, which the governor did refer to early on in his remarks, and giving them more control over our state's health system? Because whenever you take their money, we lose any control over what we do and what our recipients get.
I don't know that I would use the word eager to partner with the federal government. The reality is that the Affordable Care Act is happening. Everybody in Michigan, January 1st, 2014, will have to have insurance, or they'll have to pay a penalty to the federal government. That's just a fact that's happening. As far as Medicaid expansion goes, in looking at that, Michigan's in a unique place. If we expand, we're able to cover services that we're already covering in partnership with the federal government. And the governor referred to it. One of the biggest components of this is that everybody in Michigan is going to have to buy insurance. And the way it works is that there's a donut that's created, because our current Medicaid levels, our thresholds are about 40 to 50% of the federal poverty level. The exchange, individuals don't qualify for a subsidy on the exchange until they're at 100% of the federal poverty level. So if you look at it, there's about 320,000 Michigan residents who fall into that donut hole where they'll be required to buy health insurance, but they won't be able to afford it. To put it into perspective, you could have a family of four making $25,000 a year that would be required to go out to the open market and buy health insurance or pay the penalty of the federal government. Now, most of those will pay the penalty of the federal government and go uninsured. So it makes sense to our residents here in Michigan. It makes sense that we're able to control the situation. Obviously, there are some the Medicaid components as far as benefit levels and co-pays and those types of things that we determine at the state level. And in looking at that, the bottom line is the Affordable Care Act. The Supreme Court ruled, Obama's still the president, it's coming, and we feel that by expanding and by trying to be innovative here, we're much better poised to deal with our residents than the federal government is. And so we don't view it as the federal government coming in and telling us what to do. We're saying we want a seat at the table as we move forward. Now, the governor mentioned that the federal government may change its plans. The federal government may change the rules as we go forward. They do have some major budget pressures out there. As the governor mentioned, by putting money away will enable us to better deal with those challenges that come our way. Now, I also am a firm believer that as the federal government changes the rules, they're not going to change the rules and protect the states that didn't expand at the expense of the states that did expand. They're going to come in and look at the system statewide, and all the states are going to have to pay more if they start shifting costs to the states, irregardless of whether they expanded or not. They'll go to some sort of blended federal Medicaid rate or whatever else it might be. The key here is that the state, through the Supreme Court decision, retains the right to determine eligibility. If the federal government down the road changes the rules on us, the governor's saying we'll have enough money to create a workout solution for the state of Michigan. We'll sit down at the table and say maybe we need to change the eligibility. Maybe we need to do something different because the ball game has changed. But believe me, we've spent hours and hours and hours. Our DCH director, Jim here, who's sitting, he knows this in and out better than anybody. And I'll tell you that we strongly feel that doing this is in the best interest of Michiganders, taxpayers, residents, and everybody, because it puts us in a firm position going forward.
Representative Zemke.
Mr. Budget Director, as an engineer, I was very pleased to hear about the increased support for STEM education in the higher ed arena and skilled trades at our community colleges. My question is, what is your plan to address these areas in the critical early K through 12 years?
Well, certainly we're highlighting the initiative, and we do have some MEDC who's working with this. We have community colleges working with this, and as they work with the K-12 group, obviously the more we can get people interested in these type of areas, the better off we'll be. And we certainly have an ongoing relationship or dialogue with the K-12, with the State Office of Education. Those are clearly priorities that we like to see. And so when you look at the best practices funding that we have in the K-12 system, that does lend towards these types of degrees and this type of education. We'd love to have a further dialogue with you if you have some good ideas about it, though, because there's certainly always more that we can do.
Are you able to stay until 1 o'clock or 5 to 1 or so? I believe the House will be in session about 1. Is that correct?
No, we're done with session.
Done with session. Other work?
All day.
Can you
if there are questions, if people have more questions, I'm happy to stay. Okay, I'll stay. May not be happy, but no, I'm kidding.
In our business, meetings are not done when everything's been said. Only when everybody has said everything.
You have good wisdom.
Thank you, Mr. Chairman, and thank you, Mr. Budget Director. I appreciate the chance to ask a question. And the previous question that came from Representative Kandravas, I think, touched upon this question of transportation funding in particular. Senator Papageorge made a statement in a meeting that we had yesterday that I thought was appropriate also, which is part of the state showing its interest in this transportation discussion ought to also consider what it's willing to use of the dollars that are already spent in our transportation funding. For example, there's a portion of what we pay at the pump that is already paid for the purposes of transportation because we pay it at the pump as drivers of our vehicles and our cars. That could be used and should be used, in my opinion, for that federal match. So that $120, $130 million annually, I think, is one place that we can show that we're using what is already spent. On the discussion of infrastructure funding, I think the governor was right to also mention dredging, an issue for many of us in the state of Michigan with the second highest boat owners that we have, boat licensees in the entire nation. It's a huge problem for us with the low lake water levels. The Waterways Fund is the area that I understand that a portion of this cobbled together supplemental appropriations will come from is the transfer of some of those dollars. Those are individual communities and or locations that see that as an economic development project themselves. What is the thought about transferring out of that particular fund or putting on hold those dollars for this year? Is there some consideration as to what those communities may face in terms of projects that are let, the $11 million that they're already expecting? Has there been discussion with those communities knowing that they're expecting to have those dollars available for their projects?
We have the director here. I'd like to, if it's appropriate, I could have him come up, and this is an issue that's obviously come up recently. We know that there'll be impacts there, but we also know that there are some it's a critical issue, and we've got to get these ports dredged out. So we tried to figure out how we could cobble enough money together to make a dent in the system. So, but I'll let the director talk about it.
If I may, Mr. Chairman.
Please.
Okay.
I have to say that we have a to that point follow-up question. I'm sorry, Mr. Chairman. Go ahead.
Yes, sir. We have actually surveyed all the harbors of safe refuge around the Great Lakes. As you know, a boater's not supposed to be more than 15 miles from a harbor of safe refuge. We have looked at dredging history, so there's 3 priorities. First was the harbors of safe refuge. Second priority was high-asset recreational marinas. Third was the high-end boat launches on internal lakes. The Waterways Commission is meeting tomorrow. It's our expectation that there'll be a resolution supporting the rescission of a match because this is an emergency, as you know. We're competing for dredgers and dredge capabilities and capacities with the rest of the country. So there is a plan in place. We do know how many cubic yards need to be removed. And it really is dredging access, ingress, and egress. It's not dredging the Great Lakes. It's really maintaining those harbors of safe refuge in those local economies.
And then one follow-up question, if I could, Mr. Chair. Part of the problem in dredging has always been the application process and the approvals through the various departments of state, as well as the Corps of Engineers at the federal government level. Hopefully we've got an articulation agreement with the federal government, again, working cooperatively with them. what's going to be the expedited sort of fashion that we get about this? You know, we have sturgeon spawn that occurs that also often keeps us from being able to actually dredge in our harbors. Are we prepared for that in this emergency situation?
So we've been in direct conversations with the Army Corps of Engineers. They have direct responsibility for 56 harbors. They're going to dredge 6 only. So in those harbors where we need their assistance, we've been in direct conversations with them. 2 is Director Wyant and the head of the Office of Great Lakes, John Allen, have talked to our federal counterparts to see if there's some help there so that can help through that avenue. And then 3rd is Department of Environmental Quality has already started the permit process with DNR Staff Waterways Commission to try to identify those permit requirements.
Thank you, Director. Thank you, Mr. Director.
Thank you, Senator.
Thank you, Mr. Chairman.
Representative McMaster.
To that point.
Thank you, Mr. Chair. Mr. Nixon, thanks a lot for coming in. You did a great job on the budget presentation. The question I have is fairly simple and straightforward. Before we can go in raising taxes, raising the boat registration or the car registration for infrastructure, I'm asked, are we spending the money that we have now the best possible way? And I think as a collective body of appropriation members, we could find ways through statute or boilerplate where we can at least secure well over $500,000, close to $750,000, if not more than that. Would you be willing to let us entertain trying to shore up money that is difficult to be able to put our finger on, that isn't spent correctly, and apply that before we start looking at raising these registration fees? In other words, let us look in the internal government for money that isn't being spent properly and use that first before going to the general public and raising their rates. Thank you.
Thank you. You know, we're open to anything. I mean, we're trying to solve a $1.2 billion problem, a road problem. You know, we're always willing to work with the legislature to identify funding that can be better spent, better prioritized. Certainly a difficult task. The state, you know, when we came in, we cut $1.5 billion out, you know, our first budget. And we have directors who have been very shrewd with how they're appropriating things. But if there are areas that are poking out as being too fat within government, we're always happy to have that dialogue with you. You know, the main thing is that the pie is only so big, and there are a lot of different competing needs and interests when it comes to funding. So, you know, the budget that we've put forth, we think, is a very well-balanced budget. It's structurally balanced. It does do a lot of the core principles the governor talked about in his presentation as far as investing wisely. I will tell you that the governor himself has spent a lot of time on this budget. There's nothing in here that we haven't actually gone through, talked, vetted, looked at the data on, and recommended. So I guess, you know, the short answer to your question is we're always open to everything. The big problem that we have right now is we've got to come up with funding for our roads.
I thank you. Senator Papa George wanted to follow up on Senator Prose's question, I believe. Is that correct, sir?
Yes, thank you, Mr. Chairman. I want to return to the remarks that Senator Prose made. He covered 2 areas. One was funding every year for the federal match, which, as you pointed out, is about $120 million a year. This year, we have an opportunity to make a structural fix, not just for 1 year, but for a long time, by simply taking the money that is leaking out, that's paid at the pump, about $135 million, that's going into the general fund. If we keep it in the transportation fund, where people think it's going anyhow, then $120 million of that would do the federal match without us having to rob Peter to pay Paul every year, and we'd have another $15 million for dredging. And incidentally, dredging affects every single person in Michigan who drives a car. Because when the lake levels are low, the barges that bring the gas across Lake Michigan are not filled, which means more trips and higher gas prices at the pump. So I would ask that we look at a structural fix to this annual one-time fix problem of the federal match. And for everybody's information, there's a bill to do that. It's Senator Prose's. It's Senate Bill 6, and I hope it'll be looked on favorably by the House and by the administration.
Thanks, Senator. You raise a good point. You know, here in Michigan, we have a sales tax on gasoline. The bulk of that goes to fund education. There's a portion that goes into the general fund. Would I have set it up that way? Probably not. But that's how it's been set up for many years. Unfortunately, that money that's going to the general fund has been spent in the general fund for many years. And so to pass that bill, we'd have to identify the $120 million that we would cut out of the budget to fund that. So again, it's a matter of priorities, and it's determining if that's where the state wants to spend its money. We've just got to identify where we're going to cut the budget, because you can't just run the bill that's going to reduce the revenues, as you know very well. So it's a very delicate balancing act. We view it as not a $120 million problem or a $130 million problem. We're going to work with you to make the road match. There's no question about that. But what we have is a $1.2 billion problem, and even maybe growing bigger. So we want to take a holistic approach at the road funding issue. That's what we've advanced to you. That's what we've put on the table, and we hope to have that dialogue. Certainly the money that's being charged at the pump, that can all be part of that discussion. But again, where you push the balloon, it pops out somewhere else. And as a state, we've been very good at leveraging every nook and cranny that we have at our disposal to be able to balance the budget. Now we're trying to unwind all of those things, and it's going to take some time to do that. But that's certainly part of the dialogue going forward. But again, I want to get back to the point that our big issue here is $1.2 billion, and that's what we're putting forward to want to solve.
Representative McCann.
Thank you, Mr. Chairman. Budget Director, first I want to just commend you and the administration for embracing the Affordable Care Act, both with the request for a supplemental on the exchange and for the Medicaid expansion. I think that's a very appropriate and good move for the future of Michigan. My question is, the governor made reference to a family's checkbook, and I'm wondering, did the administration contemplate at all relief for Michigan's families' checkbooks in the form of any tax reductions whatsoever? And I could throw out a few ideas, which would be, did you look at a reduction of the state income tax rate, the senior tax on pensions, corporate income tax on businesses, EITC on families that are poor and working, even unemployment insurance rates to businesses that are paying higher unemployment insurance rates, and even landfill tipping fees. Small things, but I've seen a landfill tipping fee translate into an increased garbage bill at my home, so I'm wondering if any of that was taken into account. Thank you.
Thank you. You're talking about cutting taxes or increasing taxes? Because some of those things you mentioned would cost more money if we did that. Our tax reform actually is a package that we spent a lot of time on. We've worked with the legislature. When we first came in, it was 2 years ago, probably this close to this very day, we rolled out our tax package and we rolled out our budget package. Obviously, we think that we've put forth a very well-balanced tax package for the state of Michigan. Will we look at taxes going forward? We're always looking at taxes. We know that we live in a dynamic environment, but we strongly feel that the tax package that we have in place now is really the tax package that will take Michigan well into the future. We know that what we had before with the different people who were paying into the system and benefiting from the system wasn't really aligned. We were losing population. We weren't creating jobs. We had a very unstable environment. Businesses didn't know how much they had to pay. People, the working segment was shouldering a big bill. And so we've actually come in and we've revamped those taxes, done tax reform, and really set Michigan up for long-term economic prosperity. And I think we're starting to see the fruits of that labor.
Senator Caswell.
Thank you, Mr. Chairman. Thank you, John, for your testimony and your patience today. I'm kind of a simple guy, and I hear lots of things in this town, so hopefully you can set me straight. The Medicaid expansion we're talking about is pretty much only going to cover single adults and couples with no kids. Is that correct?
That's right.
So we're not
well,
talking...
I mean, we cover kids up to 200% of the federal poverty level now, and right. So it's the childless adults that this expansion would be picking up.
Okay. So we've already done a good job at covering our children in this state, pregnant women, up to 185%, I think. So we're only talking about single adults, possibly couples, in the expansion. The other question, and I think you addressed it earlier, but I just wanted to make sure, is the folks that are making more than 100% of the federal poverty level, irregardless of whether they're single or whatever, can get health coverage through the exchange if we choose not to go with Medicaid, go in a different direction. Is that correct?
Yeah, people can all buy insurance through the exchange. They just won't be eligible for the federal subsidy. If you look at the 100% folks, they have a bigger subsidy until they get up to 400% of the federal poverty level.
Right.
And so those people that are between our current thresholds and the 100% would not have access to either Medicaid or the federal subsidy. So it would make them have to pay the market rate for a health plan, which is very costly. I mean, which we believe would be costly.
Okay, and they have access that way. Okay, and the only other thing I want to say, Mr. Nixon, is that I've always been extremely supportive of the administration's efforts in building self-sufficiency and personal responsibility in our citizens in a lot of different areas, and I hope that continues. Thank you.
Absolutely. We'll continue to focus on that. And again, this segment of the population, it's a segment that accesses the emergency room a lot. So, we're happy to work with you on those issues. You've been a great chairman to work with, and we look forward to continuing the dialogue.
Vice Chair Tlaib.
Thank you, Chairman Hoffman. Thank you so much, Budget Director, not only being here, but also being so transparent with me in the last few weeks in regards to what's upcoming. I know that I'm really looking forward, though, to the details. One of the things that always sticks out for me as a mother of two kids, second grader, and then the baby soon will be in, obviously, pre-K, is, the issues around education in our state. And, I do look at the dashboards of the governor. I do look at different kinds of foundations that look at our proficiency on math and English among our young people. And 40% of our third graders are failing basic reading proficiency. And 26% are not even graduating on time. And then they also go into stats of talking about 25% are high school dropouts across the state. And if you look at the corrections population, 70% of the corrections population are made up of high school dropouts. And then you also look at that 50 school districts in our state is in some sort of deficit, some even over $1 million. And that's up from 2 years ago. I mean, I know we did the foundation allowance reduced from, we were at $7,300 and we went down to $6,800. And when we were talking about help for our districts in regards to retirement cost, I don't know if we want our children to have to suffer for the fact that many of these districts may not have projected in the long-term run of retirement cost because maybe the system is flawed. Maybe not everybody's paying their fair share. But I think we need to be very cautious, and I really wanted the governor and lieutenant governor and other people, but I know that you will relay the message, that I think we started in the wrong spot when it comes to our priorities in our state. We need to start with education. And $200 or whatever so forth towards retirement, fine, but is that going to really touch our classrooms? Is it? I don't think so. How? If you look long term, it's going to help retirement costs. But will that technically help get a book into a classroom right now at this moment when that third grader might end up in 10th grade and saying, you know what, I'm so behind, I'm just going to drop out. Then he gets out into the workforce, or she gets out into the workforce. She can't get a job. She ends up in our correction system. And then guess what? She ends up costing us, what is it, Chairman? I think up sometimes $60,000 a year. And you know it's almost a cycle that if we don't invest, and I understand transportation funding is extremely important. I don't think anybody here is not impacted by the fact that we have really bad roads. But if we're not taking care of our future, which is our children and our children's education, I don't really think that we're setting the foundation. I want to save towards, when we save, I want to invest it in our kids. And so the question I have, thank you.
I wondered
yes,
if
I
that
do.
was there.
I'm wondering how I'm going to respond to this.
I love my kids, all of my kids, all the kids that I talk to. And I am a person that, goes and sees these kids, in third grade, and I talk to teachers and I talk to parents, and they're really concerned because they're not educators. They don't know why their kids are failing. So the question is, are we going to take some of those savings? And they're important savings, but are we going to try to address the fact that we are at a deficit when it comes to quality education in our state? Are you going to work in trying to keep my husband and I here with this kind of education system? Because we're thinking, is our children going to have a great future here? And so I want to know, what is the long term here? If it's early childhood, great. They get a great start. But boy, if they can't get that book in that third grade classroom, or they can't get the kind of quality teaching that they need, then we're failing.
Thank you. The answer is yes, education is a priority. It has been a priority. When we came in 2 years ago, things were a mess. We had $1.5 billion structural deficit. We had a $65 billion, that's billion with a B, dollar unfunded liability that was growing unsustainably. We had a situation where the tax structure was a mess, and we really had to make priorities. The first step was to put the budget back into structural balance so people knew what they could count on. We had to make some tough decisions. We put the budget into structural balance, which has enabled us to make investments last year and this year back into the system. We didn't get into the mess that we were in overnight, and it's going to take us some time to grow out of this. We just came through a very, very tough decade in this state. And as you can see, the priorities where we're putting money into the systems, the governor's got a plan on how he's going to start to rebuild this system and reinvent this system. Education's right at the top of that list. It's very important. Now, is he going to invest into an education system that's not achieving the required outcomes that the public knows and expects? No, he's not. We put a lot of money into it. We put a lot of money into best practices, a lot of money into consolidations, those types of things to incentivize public districts to really work together and determine how they can do things better. The best practices not just give them enhanced funding from the state, but it saves them money internally. There are a lot of these reforms that we've done that are saving these superintendents in these districts a lot of money, what's keeping the money in the classroom. And so to answer your question real quick here, I was taking a lead from you, Representative. To answer your question is yes, education will be a priority. We look forward to working with you on that. Our kids are important to us, and we know that they're our future, and so we need to build the system on a structurally sustainable course.
Thank you. Senator Colbeck, we're running out of time here. Do you have a brief question?
Yeah, I'll try to be brief on it. I want to talk about Affordable Care Act, and I think the reason you're getting so many questions around that is that roughly, federal contribution to health care is around 20% of our budget from my quick calculations on it. So it's near and dear to my heart. And my concern is we've done a lot of work around fixing our structural budget deficit, as you pointed out. And I fear that our desire to go off and address things like the $31 million supplemental, the Medicaid expansion, the health savings account, all these items are tying into that Affordable Care Act. And I'm concerned that Michigan's going to inherit the inherent structural instability that we have at the federal government by further getting in bed, pardon the expression, with the federal government on this subject. Now, 25 other states have said no to the state-based exchange. 7, including our own, have letters of intent to pursue the state partnership exchange by default, because we don't have a state exchange right now per legislation that did not pass in the last. We're defaulted to the federal exchange. And from what I understand, the federal exchange is not funded for development out at the federal government. They do not have the dollars to build that federal exchange. So if you're seeing reticence around pushing back on the, I don't think it's a done deal that this Affordable Care Act is something that's going to be coming into place. And I for one, am leery about, tying my horse to that wagon right now, because I think it's bad for the citizens of Michigan overall. And I think there's also a competitive advantage for the state of Michigan if they have no mechanism to impose that $2,000 per employee fine that's going to be happening, because the way that they do that is via the exchange, from my understanding. Then we have an opportunity here in the state of Michigan to differentiate ourselves competitively, improve our job situation as other businesses are, as we've done a lot in the recent months, to improve our fiscal situation. So I just want to make sure, it's more of a statement than a question. I mean, when we're talking about a lot of the pushback you're hearing from a lot of people, a lot of questions, it's because we think that there's an opportunity here to make sure that we do something special for the citizens of Michigan that's really going to be in our best interest long.
I thank you, Senator Colbeck. We're not doing statements so much as we're doing questions, so we'll proceed over to the good representative.
Thank you, Mr. Chairman. We're going to try and shorten these questions. I'm going to start with Terry Brown.
You can tell the chair and I have worked together before. He's already warning me, so I appreciate it. We just received the budget, and of course, we haven't had the chance to study it yet, but I'm wondering where some of the money comes to pay for some of the priority programs that certainly are near and dear to a lot of us, like early childhood, like dredging, like ag processing ventures, the grant opportunities that are out there. Where, can you just give us briefly, are we just kind of reshuffling and saying, here's what we've got, here's a way to reshuffle this, and what are we losing? And particularly, I'm concerned, I know there's a cliff coming in public education and K-12 budget here, 2014, 2015, and then there's a threat of sequestration. Can you briefly kind of touch on those things for us?
Sure, absolutely. And I will tell you that a new budgeting practice that we've instituted here in Michigan is to actually do a longer-term forecast. So this budget that we're presenting is a 14 and a 15-year budget. We're even looking out further than that. Our economists go out 3, 4, 5 years in their forecast. And so we're looking longer term. We're also separating out the one-time versus ongoing funding. And so when you look at the funding that we have in this budget, a lot of that is created from growth in the general fund, growth in the school aid fund, and we've been able to take that money and strategically invest it. The reason we've been able to do that is because we've got the budget into structural balance. So as the budget grows, we're growing 2 to 3%, 3 to 4% next year. As we come out of this economy, we'll be able to strategically reinvest that money. So as we're spending this money, we're doing it in a way that will improve government services, that will pay down our liabilities, will put money away for a rainy day so that we can better deal with those longer-term instabilities that you just referred to. And so we feel like we're in a pretty good fiscal position.
All right, we're going to take one more question. We're going to finish with Representative Singh.
Thank you very much for the opportunity to ask a question, Mr. Chairman. Please don't take any indication from me moving up here for any plans for 2014. My question is about long-term planning for the state of Michigan. I come from a community where we have a AAA bond rating when I was mayor, and so I have a lot of respect for having a healthy rainy day fund as well as looking at long-term planning. But as I take a look at the higher ed budget, you talk about there's being a 2% increase on top of the 3% base from last year. It's still an overall cut as we take a look at the 15% cut that we had. I have groups like Business Leaders of Michigan who are suggesting that we actually need to invest $100 million more than we're doing now every year for the next 10 years. I also take a look at the revenue sharing, which looks like the statutory numbers are actually flat this time instead of any increases. I did see the governor acknowledge that one of the big risks for the state of Michigan is cities being distressed. And I also see the acknowledgement of public safety being needed when we talk about expanding the state police, but not necessarily local. When do we get to the benchmarks for helping these universities or these cities get to an appropriate level of resources? Because every group that I'm talking to is telling me that we're not investing enough in those places. And then how do you look at that when you take a look at how much money you want to put into a rainy day fund, that we need to put another $1 million in the rainy day fund versus more police officers in my local communities? Can you help us understand what the administration goes through to make those decisions?
Absolutely, I'd be happy to. Certainly, as you grow the budget and hire police officers, put money into education, you've got to make sure you've got long-term financing to be able to do that. When we make deposits in the rainy day fund, those come from one-time surpluses. You don't want to go out and hire a bunch of police officers with a one-time surplus because you're not going to be able to keep them on the following year. So as we're budgeting, we're actually separating out those revenue sources. As I mentioned before, we've been through a really big recession, not only in the country, but particularly in this state. And as we've laid out the foundation and the priority, many of those areas that you're talking about are those key areas that we want to invest in. And we are doing that. As you mentioned, higher education, we did 3% last year, 2% this year. Can we do more? We would love to do more. But the issue is right now the pie is only so big. And as we're growing, it's important for us to really establish the priorities of where we want to invest, but not just where we want to invest, how we want to invest in those areas that will really help drive long-term economic stability, bend long-term cost curves. The rainy day fund is a key component to our fiscal management. Too many states operate in crisis management. If they lose money, if they don't have a rainy day fund to help them bridge the gap, they're in crisis management. So the way we've structured this balance, or built this balance, is we're in control of the budget now. We're in the driver's seat. If the economy goes down or we have an unforeseen circumstance, we don't have to go into panic mode because we have the resources to be able to do it. So coming from a AAA rated entity or community that you were there, that's where we want to get to as a state, because it's not just to have the marking, but it's actually to say we're in control of our finances. And it really should be the ultimate goal. And as you know, structural sustainability, structural balance, rainy day fund, living within your means, having a long-term structurally sustainable revenue stream, those are all components of that.
Director Nixon, I want to thank you for the presentation. I thank the Governor and the Lieutenant Governor. I thank all your departments for being here and your staff.
Our pleasure.
I'd like to adjourn the House. If I can get a motion.
So moved.
So moved. We stand adjourned.
Moved by Senator Colbeck, supported by Senator Jansen. All in favor say aye. Aye. The Senate is adjourned.